All right, guys, let's talk rabies. Rabies virus, most people associate with dogs, foreign dog bites, things like that. I am going to explain to you once again why dogs are man's best friend, but bats you should probably stay away from. And it's all because of this one, rabies virus. So, rabies virus, otherwise known as rhabdo, is a uniquely bullet shaped virus. So, I'm just going to draw this here. It's an enveloped, single-stranded, negative sense RNA virus, and it replicates in a fashion very similar to the paramyxoviruses, which you learned about back in Cameron-Thompson. It has a helical nucleocapsid inside it, so I'm just going to try to make a little helix there. And it has a couple things that play an important role in the actual immune response. The first is the G protein. The G protein basically appears like these little spikes all the way around the nucleocapsid. G protein is what allows the virus to attach to cell membranes of host cells so the virus can enter the host cell and replicate. It's its key in. We do, however, make neutralizing antibodies to G protein, which is really good for us because that's actually how we could stop it. And that would actually block it from getting into the host cells. Now, even though we make antibodies, this is not truly protective. So if I get infected with rabies, my antibodies, but my serum could be given to somebody else to help neutralize the virus as convalescent serum, right? So remember, this is called passive immunity. So I'll make antibodies if I get infected with rabies, but probably not fast enough to save me before I die a horrible death. So, but my antibodies could be used to help somebody else. So that would be good. The virus will most likely kill me, but I'll be chock full for someone else. The other component is nucleocapsid. Nucleocapsid is the major structural protein of the virus. It's not really protective, but when antibodies against G protein are formed, they fix complement, and that actually can help promote the immune response, right? Because what are the main roles of complement? Well, the first one, hopefully you all shouted out in unison, is opsonization, right? That's the main thing it does. And that can be helpful. I mean, it's always good to swallow up viruses and destroy them. Unless it wants to get into that cell, then that's a whole nother story. But the other thing it does is inflammation, right? We have those anaphylatoxins and those chemotoxins that are going to recruit more immune cells to help promote the inflammatory response. So that can actually be very helpful. Okay, so let's talk about how we actually get rabies. And I'm going to tell you a story of my upbringing. This is a zoonotic virus. That means it infects humans and animals all in one big zoo. That is the world. It's endemic on a whole bunch of animals all over the world, except for the land down under. If you are from Australia, congratulations. In your humble, wonderful home, there is no rabies. It is maintained, however, in skunks and bats and cats and dogs, wolves, foxes, raccoons, bats, but never rodents. Never ever rodents. Squirrels, rats, mice, prairie dogs. I'm sorry to tell you that all this time your parents said that you couldn't pet the fluffy tails of squirrels because you would catch rabies. Well, they lied. This might be something you guys could talk to each other about after you do the psych cases in a couple of weeks, but squirrels can't give you rabies. Other things, sure, not rabies. There's no such thing as a rabid squirrel. If you are bitten by a squirrel while chilling on the lakefront path, not a problem. Now, if you're hiking in a forest preserve and a crazed raccoon comes out and bites you, go get a rabies shot. So because it's zoonotic, we have to think about transmission in the animal and in us. And there are different transmission times, right? So just like when we were talking about the mosquito-borne viral infections, the mosquito had to pick it up, the virus had to replicate in the midgut of the mosquito, and then infect the salivary glands of the mosquito. It's a similar process for rabies. It has to be picked up by the animal, replicate within the animal, and then infect the saliva. So we have different days for this. So if we're talking about a dog that picks up rabies, it's really quick. It's only 3 days from the time the dog is exposed to the time that dog would be considered rabid, where it is able to spread the infection. Cats, even shorter, only about 2 days. If we're talking about skunks, though, then it's a little longer, 18. And for bats, which are actually kind of a big reservoir for it, it can be months. So this timeline can play a role in controlling the reservoir. Now, humans in general have received the rabies vaccine or the rabies virus from dogs. Throughout the world, dogs are the main reservoir for rabies, but in the US, most of them are vaccinated. Thankfully, there are good vaccination programs in case, so this is really well controlled. So we really only see this in places where animals are not routinely vaccinated. There are still about 70,000 cases per year worldwide, but only approximately 3 per year occur in the United States. The incidence is greatest in patients less than 15 or more than 55 years of age. Again, cell-mediated immunity. And typically we see it in men more than we see it in women. That isn't to say it can't infect women, but we just tend to see it in men more. In this case, we get the virus through bites in the saliva. Now, remember, we need to infect it, so it's got to contract it and it's got to be in it. Now, while bites are the most common, we can occasionally see it as an aerosol. This is especially the case with bats. Bat spit in particular. If a bat spits on you, you could theoretically be in trouble. But I mean, how often does that really happen in a given week? It's not all that common. I guess maybe if you're Batman and you spend a lot more time around them, sure. But bats are not commonly a reservoir, but they are sometimes a transmitter. So a bat goes down and bites an infected skunk, then it becomes infected. And then if they bite you, you could be transmitted. So how would we potentially come in contact with bat saliva? They're almost like a great big mosquito. Think of them that way. Bats don't typically bite humans. We aren't really great food for them. But a lot of them like to eat the little bugs that like to hang around us. So in the summer, you're outside and gnats are flying around your head. The bat might swoop in real close to grab the gnats. And in nabbing at the gnat, some spit flies out and potentially infects you. Really rare way it could happen. Now, once a human contracts rabies, they also become transmitters. And the same can be said for cows and horses. We don't really think about a rabid cow all that often, but they can be kind of secondary transmitters to us. So think about it. If you're a farmer, cows are a main source of income for you. Now, you are tending your flock or your herd, and one of them appears to be foaming at the mouth, having difficulty breathing, you're going to run over there and think your cow is choking and try to save it. And so you reach into the cow's mouth to try to get out whatever is potentially harming your cow, and the cow bites you. And that is a way that you could get infected from your cow. Okay, but let's talk about the other way we can get it. There have been instances of rabies transmission by transplantation. This again, thankfully, is very rare and now is screened for. But this is actually the cornea of a patient who received this cornea via transplantation. And these green dots here are actually rabies virus. So basically her or his donor contracted rabies and died for unknown causes, and the tissues were transplanted. And this patient, as well as several others, unfortunately contracted rabies and did succumb to the virus, because obviously an immunocompromised person is a really bad place to have a rabies infection. Okay, so let's talk about rabies itself. If untreated, rabies is virtually always fatal. A lot of what we know about how rabies is spread actually came from an event that occurred in about 1951 in Siberia. A pack of rabid wolves came into a small village and ravaged a village, biting dozens and dozens of people. And they didn't have access to the vaccine, and many people actually got exposed to rabies. So some of the physicians did a very careful analysis of their time course and symptoms and put it all together in a publication and timeline, basically giving us a natural history and variations in rabies infection. So we got a huge N all at one time. We typically can't do this because typically a large group is not infected all at the same time in the same place, the way this was. So this is the time course of rabies as I'm showing it here, with different types of clinical symptoms that occur based on a hypothetical component case. This is not any one individual, mind you, it's just a whole bunch based on a whole bunch of individuals who happen to have all gotten bitten at the same time. So what happens? You get bitten by a rabid animal. There is a fairly long incubation period, anywhere from about 2 days to, or 2 weeks to 16 weeks. So this says 20 to 90 days, somewhere in there, but it could be longer. During this time, the virus has to travel through the peripheral nervous system up to the brain. So the virus first multiplies at the site of the bite. Then it starts on its odyssey to the brain. This long period allows for some post-infectious vaccination, which is really beneficial. So what are you going to do? Patient comes in, they've been bitten by a dog or a crazed raccoon on the lakefront path, and you need to treat it. First thing you're going to do is you're going to clean the wound. So we're going to clean it with 70% ethanol. It's going to be really good at cleaning out whatever else might have been in that animal's mouth as well. Then you're going to treat with both a vaccine and immunoglobulin. Now, listen to me very carefully. The vaccine is whole-killed rabies virus. So that is giving you active immunization, right? From the vaccine, we're going to make our own antibodies. That's going to take time, right? Okay. In the meantime, we're going to do passive immunization, all right? So you're going to give the first vaccine on day 0, and then you're going to give 5 more doses on a weekly basis. In the meantime, you're going to give the immunoglobulin right at the site of infection. So if this is my person who's recently been bit, let's say they got bit here, we're going to put the immunoglobulin here, right? And it's going to bind up free virus. We're going to put the vaccine somewhere else, distant, right? Because we don't want the immunoglobulin to bind to the vaccine. We want the vaccine to be available to prime the active immune response, and we want the immunoglobulin to bind up the extra virions that are at that bite site before they make their ways into the cells. Okay. All right, so this is very effective at neutralizing the virus and preventing this disease. During this time, here's the tricky part. There are no symptoms. So unless your patient shows up and says, hey, I was bit by a crazed raccoon on the lakefront path, then you're not going to know to treat them. Because even though the virus is replicating, it's not replicating in the neurons yet. It's going to use acetylcholine receptors on host cells to enter it, and it can replicate in a large variety of cells right there at the bite site. Once symptoms start, the disease progresses rapidly. First, you have a prodrome, basically undifferentiated fever, right? Anorexia, nausea, vomiting, headache, malaise, lethargy, pain, or paresthesias at the site of the bite. Once we've reached paresthesias at the site of the bite, it's kind of game over. And that is because at this point, this tingling sensation is a sign that it's entered the neurons. At that point, medically, there's not much we can do. There is essentially no survival at that point. Once it gets into the neurons, mortality is essentially 100%. The prodrome lasts about 2 to 10 days. Then we move into the acute neurological phase. This is basically more specific neurologic symptoms. You can see hyperventilation, hypoxia, aphasia, incoordination, paralysis, hydrophobia. That's that idea that rabies patients are afraid of water. They get spasms in the esophagus. They don't just not want to drink water because they don't want to drink anything. It's because the pharyngeal and esophageal spasms. They become confused, delirious, maybe some hallucination. And this is where we see furious rabies. This is where a patient might try to bite and attack you because of the marked hyperactivity. And they might try to hit you or scratch you either. That is going to occur in about 80% of patients. The other 20% of patients will exhibit something that was previously referred to as dumb rabies, which I don't really like that term, but basically they don't develop the hyperactivity, only the generalized paralysis. And I'll show some pictures of that in a minute. Eventually, patients drift into a coma, and you see hypoventilation, hypotension, and eventually cardiac arrest and death. And this is basically due to the total destruction of the CNS from the virus. Now, there is this line here, death occurs or recovery begins. Basically, you can cross this out. There is no real recovering from rabies. That's kind of a lie. In the entirety of medical history of rabies, as far as I know, there have only been 4 cases of individuals who got neurorabies, had the symptoms, did not get the vaccine, and survived. All of them had severe neurologic damage, and they remain effectively unresponsive for the rest of their lives. They were saved by placing patients in a medically induced coma, so they survived. The first of which was a girl in Wisconsin. A bat flew in her room in the middle of the night. They chased it out with a broom, went back to bed. She hadn't been bitten, so they didn't come in for a rabies shot. And several weeks later, she began developing symptoms of neurorabies. Okay, here's some images of what I was showing you before. This is furious rabies. So this individual is, you can see, restrained here and trying to kind of break free and attack. This is what is referred to as dumb rabies. You can see this is the foaming at the mouth that people often associate with rabies. Again, that's because of the spasms, so the patient isn't able to swallow appropriately. Okay, so rabies is characterized by encephalitis, neuronal degradation. You can see negri bodies within the brain tissue, the nerve tissue. You'll also see eosinophilic intracytoplasmic inclusion bodies, especially in the hippocampus, Amon's horn, and Purkinje cells in the cerebellum. So pathologically, we're looking for those negri bodies. How can you diagnose it? Well, early on, you can biopsy the skin early on and do immunofluorescence, much like I showed you in the transplant picture. You can also test the transmitting animal, their saliva, brain, CSF, or urine. Obviously, that doesn't often work, particularly if we're worried about like a bat. You're not going to catch that bat again. But if you're able to test the animal, that's probably your best bet. But these days, you would just go ahead and treat. You're not necessarily waiting to diagnose it. You don't wait. You treat early. Because once you're actually trying to figure out what it is that's causing disease, it's already too late. You can look for viral titers in the CSF. You could theoretically look for serology, but remember that takes a long time. So that's going to be too late. So don't wait, just treat.